whereby it's not just being an academic and focusing on in whatever your goals are, maybe to publish 5 papers or to do this and that. What we all looking for or looking after is to effect change.
Yes.
We all hope that our motivation is to effect change. So if you're a student, yes, it's well and good to have good marks, but there's a difference between somebody who is studying for a degree and somebody who is studying because they are preparing themselves for a career. If you are preparing yourself for a career, degrees are not enough. You and I know that the difference on the job market is not just about having a qualification. It's the other things. So if you can volunteer in a community somewhere, good. If you are passionate about something, why not start your own thing? Even if it's a focus group, even if it's a whatever initiative, it should go beyond just looking for the degree, looking for the marks. You need to be able to open our eyes to what our people are suffering from, what are the burdens that our people are dealing with, so that we can help and alleviate a little bit. That applies for academics, apply even for people who are professionals. You can be a good accountant, but maybe you should realize that around you, people have poor financial literacy. So yes, it's good to make a lot of money being an accountant, but maybe you put 2 hours or 1 hour on the side to help people who have poor financial literacy. It's by giving ourselves that as Africans, we will be able to make a difference, rather than to sit and being, as society has wanted us to be, very selfish, very self-centered. I grow my own family, have my own career, have my money. If we open our mind and going back to those values that were ours or those of our ancestors, to give ourselves, that's how you find your purpose in society. That's how you become, beyond being just a medical doctor, you actually become a medical doctor who make a big change and change lives of people because you give of yourself.
You see, the thing with the podcast is that we're not constrained by time, because for an expert like yourself, we don't have you all the time. So, and also we want the platform to, when someone is watching, to gain as much knowledge as is possible. So, and I really like the way you're breaking it down. Why do we build hospitals when we are not even taking care? We are at the end of the chain instead of at the beginning. And I think the beginning is very powerful, because that's where we can save our future.
Exactly.
If we want to have a future to be proud of, like the future that we say we are going, Africa is going to be the youngest continent in the world with the youngest population, we are going to have to do something about it. So actually very drastic to make sure to have our own future in our own hands, literally. And I think health is at the center, because if we don't have a population, the land will be empty and people will come here and people will come and inherit our grandparents' homes. Many African health policies cite evidence, but fail in implementation. From your expertise, where exactly does the translation chain break down? And what institutional reforms are required to move from pilot projects to scalable systems?
Well, thank you. That is really an interesting conversation. And in the discussion with my Kofi Annan fellows, that question has come up.
Okay.
People say that when you deal with global funders, money is made so easily available to fund workshops or strategy building meetings or seminars. And there's so much money. If you say you want to do a workshop and whatever, you will get the money. When you say that, okay, we have a strategy, we want to implement it, there's no more money. Nobody wants to fund in implementing the strategy. Very few funders put money into implementing strategies. And again, because of the lack of leadership of our leaders, sometimes we put out strategy, we don't post the strategy. It doesn't come with an operational plan, a clear roadmap from policy to implementation. We forget all about that. Oh, we have a strategy, we celebrate it, we have a big party, we print it, we distribute everywhere. Okay, so what is the roadmap to implementation? If I want to be to start a steer, we experience the same thing here in South Africa with the the national strategy. We have a document, we call it the National Strategic Plan for the Prevention and Control of Non-Communicable Disease.
Yeah.
For the first time, the plan came with targets. We call it the 1960-50. Those who have worked in the HIV space will be familiar with what came to be known as the 1990. It was a policy that came up in the HIV space where it was about improving the response by improving screening, improving linkage to care, and improving targets and outcomes. We apply the same in the NCD world. So we say 90% of people living with diabetes or hypertension should know their status. 60% of them should receive some sort of intervention, and 50% should be managed or controlled, as they say it.
Yeah.
Very nice strategy. Some people can argue, oh, it's not ambitious enough. Why not similar to HIV 1990? Why do we say 1960-50? Blah, 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 blah. When then you say, okay, what is our baseline?
Yeah.
You realize that there is no baseline. How do you have a target but you don't have a baseline? You say it's a strategy from 2022 to 2027. If you don't have a baseline in 2022, how are you going to assess progress in 2027? How are you going to assess whether you actually moving towards the right direction? Do you have a midterm evaluation halfway to the? None of those questions are answered. So meaning when we reach 2027, which is in 2 years, or 1 year actually, is next year, we'll all be looking at each other. What should we say? Are we met the target or not? How far are we? What are the lessons learned? None of that will be answered because a strategy has been published without an ecosystem to meet those targets. And it's one of the topics that I discussed in one of my edition of my newsletter on LinkedIn. The fact that it's easy to see that we're not going to make the target because the target was putting the target out was the goal. Reaching the target wasn't the goal. And it goes to your question that we put strategies, we don't have the mindset that am I actually going to make that goal? It's like when you are in the new year, as we are in the new year, people come with New Year's resolutions.
Yeah.
But in their mind, they don't have the clear plan
of how to achieve the resolution.
So it's just about the resolution. You can write it nicely. Okay, I'm going to do this. I'm going to do that. But what is your plan actually? So that's basically
what is the roadmap?
Exactly. That's what actually we do, unfortunately, on the continent. But again, you understand that a field like public health is still a young field on the continent. And unfortunately, maybe those who were there before us didn't benefit from the training that we now have. So yes, it's been the habits or it's been the practice on the continent, but it's about time that changes. We need to be saying that, no, we're not going to invest in having workshops and seminars and all those things. We're going to be pragmatic and we're going to go to effecting change. So if that's the mindset of our leaders, that's why I like when you look at on the continent, places like in Rwanda, when we look at places like in Burkina, where the leader there, Traoré, is now bringing in that new way of doing things. We need to focus on action and on impact.
Yes.
Let's leave the beautiful document with colors and all that. Let's be pragmatic. So more and more, I think that energy, more and more that thing will be really
it's inspiring other people. Yes,
inspiring other people, and more we're going to see change, and obviously to be able to respond efficiently to our challenges on the continent.
Another thing that I want to just stay on a little bit, Doc, is that when you talked about the fact that if you want to host a workshop, a seminar, a colloquium, something to talk, there is money. That means there's actually it looks like there's an intention to fund temporality. So funding temporality is part of the project itself not to fund permanence. So if it's temporality, there's money. But if it's permanent, if it's implementation, if it's impact, then there's no money for that. Maybe you just want to talk about some of those challenges right there.
No, definitely. Now that's for example, recently when Donald Trump decided to stop the USA thing, to dismantle it. Obviously, you remember there was a lot of talking about it, but one of the beautiful things that occurred is that people actually start questioning or asking, is really aid helping us? That money that we receive from outside, is it there to help us, or is this a way to keep us dependent forever? If you come to me and you say, Patrick, I don't have food to eat. Okay, here
I give
is
you food.
bread. Go and eat. I know you're gonna eat and finish and come tomorrow. Maybe for whatever intention that I have, I want you to keep coming. Therefore, I'll keep giving you bread. No, it's easy for me to give you bread.
Yeah.
But as long as you're gonna come back. But if I like you, and then you say, Patrick, I'm hungry. I say, okay, where are you coming from? I'm coming from this place. Okay, is there water next to your place like a river? Okay, let's go. Let me show you how to fish. Oh, is there no water, but there's a field? Okay, let me show you how to plow your thing.
Yes.
With trials and tribulations, whatever.
Yes.
After 1 year, 2 years, I'm not gonna see you anymore. You will be fishing there. You will be farming there, doing whatever you are doing, feeding even other people. If my intention is to keep coming back, I have a different attitude. So you realize that for whatever reason, those donors, as they are described, want Africa to keep going back to them. Therefore, it's easy to fund talk shops and things that will lead to nothing. And trust me, there is a clever way of even influencing the outcome of the talk shop. I'm sure we all watch when you have those big meetings in Africa. We're supposed to be talking African problems, but you see people that don't look like Africa in the room. You think they are there as tourists, or you think
making sure
they're there to make sure. I say, as Africans, let's not be naive anymore. We want to talk Africa. Thank you. Can you excuse us? Let's talk Africa. When European Union is doing their meetings there, are you invited to be in the room? To be what are you doing there? Are you European? But for us, it's normal when we are having our African Union meetings or AU meetings that you see some people there that don't look like us. I'm not saying that we need to close our borders, but we need to be more strategic in the way we do things. Because at the end of the day, when the family gathers to discuss family problems, you don't allow the neighbor to come there as a tourist and put his mouth in your family problem. You deal with it as a family problem. The time comes when you open your door for the neighbors to enter, but that's when you finish resolving your problem. Yes. But every time you see us discussing our things, you always see those people roaming around. I'm telling you, I was at a meeting at a conference in Kigali. The topic was about diabetes in Africa, what we should do about it. There was a panel, those panel discussion where you are out of 6 panelists, only one was a black person from Africa. All of
talking about Africa. That is a paradox.
I couldn't help it. I raised my hand. I say, you are looking for the problem. This is where the problem starts. Didn't you find African experts to talk about diabetes in Africa? What is people coming from America who tell me about diabetes in Africa? Somebody I don't hate them, but come on. When they talk about diabetes in America, they don't invite us. Let's to say on the panel. What's that?
Yeah.
But these are things that we've been accustomed to, and we accept it. If we want to change that agenda, we will have to be first truthful with ourselves and self-introspection, and then act boldly. That means, obviously, if you want to start, and they say, what you say, you cannot bite the hand that feeds you, or the one who gives the money is the one who dictates the outcome.
Yeah.
So that means, as African country, we will need to start finding money to fund
ourselves.
Our own things. because that's where everything starts. If you keep saying, oh, there's a beautiful African strategy, what? Oh, the EU is funding it. If it's such a beautiful, important strategy, why is Africa not funding it? So this is where things start. Let's start finding money for our own things and make a boundaries with those people that might have agendas that are sometimes unknown to us. And that's how we can change this thing where more money is going towards things that eventually don't actually build, but just keep us in this dependency cycle where we keep asking, and then it's called aid. Meanwhile, we are not being helped.
And he who pays the piper dictates the tune, they say. And it's just like you talked about how, when we started our conversation about how in the past, even though they found out that smoking was bad for you, but they paid some fake scientists, so those influencers that are coming to contribute to conversation, you think that they're talking, why would someone speak about our own interest for us? They weren't. That can be very easy to see. As the chair of the Diabetes Alliance in South Africa, you operate at the intersection of civil society, government, and academia, and lived experience. What governance failures does this alliance attempt to correct, and what tensions inevitably arise when these actors actually share a table? You've already touched on this a little bit, but perhaps you want to just tease out some aspect from the academic point of view.
Well, that's really a beautiful question. Not only academic, we mentioned lived experience, and I like it. There's a principle that we call meaningful participation of people with lived experience. What has been lacking for the main part is that strategies, policies, big decisions are being made without involving people with the condition themselves. People who are actually supposed to be saying whether it's something they need or they don't need, or how we should implement it, or how we can achieve the strategy. So what the Diabetes Alliance is trying to achieve, one of the things that we do with what we call a whole of society approach, we ensure that people with lived experience have a seat at the table.
I see.
So that when policy are made, yes, the scientist has to do what the scientist has to do. The academics has to do what the academic has to do. But the people with lived experience are also experts in their own right. They live with the condition 24/7. They are the ones who have to find ways to do well under this condition. Yes, we are trained, either doctors, public health, policymaker, whatever. But sometimes we talk of something we don't know. The science and the numbers that we see through research is not the full picture. Therefore, having people with lived experience involved around the table, it brings a perspective that a person like, obviously I'm not going to say that we're not just for the sake of the argument. Maybe because, let's say we are not living with those conditions. People who are not living with those conditions won't see. I spoke to you earlier about, for example, the importance of mental health. It came to me because I listened and I spent time with people who are living with the condition. Otherwise, when in 2020, we started the University of Pretoria Diabetes Research Center that I co-founded with my mentor and professor at the University of Pretoria. When we started the Diabetes Research Center, we had clusters. None of it was speaking to mental health. I went to a meeting once, and there was a panel with lived experience only, people with lived experience. When I finished listening to it, I turned to my prof at the time and I said to him, we forgot to bring mental health in the research center. And that's I initiated and I put together a mental health cluster because of listening to them. So therefore, what the Diabetes Alliance is trying to do is really to bring that perspective. And in terms of how it can be uncomfortable, obviously, when you come with that pride that I'm the expert, I'm the thing, I have nothing to listen to somebody who doesn't even have a university degree, and they say because they have the disease, they're also an expert. When you have that arrogant attitude, obviously, it can lead to clash because If you don't have the humility to listen to them and to understand that their perspective is valid, then you can be like, no, 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 no. Which research have shown that? Show me the paper that is backing what you are saying, and you invalidate the views and the opinion. So yes, having the people with lived experience around the table can lead to challenging conversations, but we need to remember that we are all trying to improve something. We are all trying to make a change. And what they want to do, because they live with the condition, is really to ensure that change occurs. So whether you are academic, whether you are a policy maker, whether you are a government official, it's important that we approach it with really a lot of humility to understand that the perspective, we don't have it and we need it so that the policy at the end of the day is more comprehensive and whatever action that we put in place is more
responsive. You work across borders and systems within Africa. What asymmetries between countries must shape NCD outcomes, and how realistic is a truly coordinated continental response given political and economic fragmentation? I mean, we speak English in one part, we speak Portuguese in the other part, we speak Spanish in some countries, we speak Arabic in the others, we speak French. This somewhat has fragmented a coordinated effort to have an African agenda for NCDs.
No, indeed. Again, a legacy of the past, the borders that we inherited, the language that are spoken on the continent, the way we see things, where it's easy for you leaving Nigeria to go to the UK rather than to cross the border into Cameroon. It's easy for you from South Africa to go to the UK than to go to Benin. We know all those challenges. We are living those difficulties every day. I think what has been lacking is that instead of focusing on the challenges, what about we focus on what has Africa to gain by coming together and working together? I will go a bit out of the health thing and talk about, I was watching President Museveni from Uganda. He was making an analogy that's the one who was really picked in my brain. He said, in his tribe, there are farmers, they grow cattle. And the neighboring tribe, they are the one who cultivates the ground, the one who deal with the crops and everything. If you have a tribal attitude, that means me, who am a cattle herder, I can only sell cattle to my tribe person. But my tribe person is also a cattle herder. So he cannot buy cattle from me. I cannot buy cattle from him. We have to get out of the tribe and go towards those tribes that sell crops. We don't have. Maybe they sell crops. I sell them cattle, they sell me crops. Now he said, if I limit myself in my province, how much of us are there in the province who need cattle? I need to probably start selling at the scale of the country. But even then, if you have ambitions, how much of us are we here in Uganda? Maybe 10 million, 15 million, 6, I don't know how many millions, but it's a very small market. If you want to grow in a small market, your cost of production is very high and your market is small. Therefore, products are expensive, your benefit is small, you cannot go far. If China, where there are 1 billion plus, one country, sells out of their country, how much more us Africans shouldn't understand that the secret is by selling out of our borders. So when you start thinking economy, when you start thinking those markets and those fancy words that people better expert than me can understand, you realize that it's in our best interest to break down those virtual borders and to unify, which is applicable to economy, is also applicable in health. We spoke about strategies, right? In South Africa, we have an NCD strategy. In Zimbabwe, they have an NCD strategy. In Lesotho, which is, for those who don't know very well, Lesotho is like a country surrounded or inside South Africa. They have their own NCD strategy. Are you going to tell me that the risk factors that the population from South Africa, from Zimbabwe, from Lesotho, and even Swaziland are exposed to are different when it comes to NCDs?
I wouldn't
If
think
the
so.
risk factors are the same, if the environment, the ecosystem is more or less the same, why do we have different strategies? Mind you, to put together that strategy, we invested many years because we needed to consult and everything. So there were a lot of money put into those meetings, a lot of investment into those things. And eventually we have a strategy that maybe will last for 5 years. Then we need to do again another strategy for what if South Africa, Lesotho, and others
Eswatini.
come together and say, we have the same problem. Let's have a regional or
NCD.
regional strategy. The other ones in the other area, they have one. The other one in the other area, the other Western Africa, they also have one. And after that, now you have representatives from all those areas come together. We say, okay, we already have regional strategies. How about let's come together and now have a global continental strategy? So yes, there are challenges, but those challenges can be surmounted. Language is easy. In Africa, thanks to colonization, we are speaking a language that is now allowing languages that allow us to communicate across our borders. So therefore, we cannot have that as an excuse. But again, as I was saying, when you say, what do I have to gain by having a continental strategy? Is whereby you have a response. Let me deviate again just for a few seconds. We are talking about universal health coverage, right? Which is an insurance system. Insurances depend on the number of people who subscribe to it.
Yeah.
If you are 5 people in an insurance scheme, your contribution will be much higher compared to an insurance scheme where there are 100 people. Isn't it so?
It is.
Now, you have a country like next door here, I will give the Botswana.
Yes.
Resources, diamonds, everything, but how many are there? Maybe 3 million? They want to go towards universal health coverage. The premiums that they have to contribute would forever be high. Meanwhile, imagine that there is a universal health coverage system that includes South Africa, Botswana, Zimbabwe, Lesotho all together. We are talking about maybe 100 million.
Yeah.
The contribution will be less. So you see, if we have leaders who are visionary, who forget or who detach themselves from the influence of the colonization, they realize that this is the way to go. Africa can only achieve universal health coverage if we come together, because those products that we need to buy are so expensive that the premium can only be very high if it's few people who are contributing. But if more people put their contribution, they become less, we can eventually meet it. I promise you, a country like Lesotho or Botswana, I don't want to say I'm being controversial, they will never achieve universal health coverage. It's simple health economics. The contribution will be too high. The government will have to put too much in, and eventually the deficit will be too high, they will go bankrupt. You need to have more people contributing so that the contributions are less. Therefore, it's another reason why, whether we are talking about NCDs, universal health coverage, or economy, we need to have the African view rather than having our small countries view. Meanwhile, we are all struggling with the same challenges.
As a Kofi Annan Fellow and emerging global health leader, these are 2 awards that you have you received in 2024. How do you think about legitimacy in health leadership today? See, you kind of touched on that when you talked about universal health insurance, especially in the context where expertise, lived experience, and political authority do not always align.
It's a very profound question. And it really applies a lot in health, because the agenda in health has been sometimes dictated by outside, or there's been some players who have had more, who exert more weight than others. For example, the politicians that are the one who holds parliament, they decide how the budget will be spent and which regulations and laws are need to be put in place. Meanwhile, for the most part, they might not have the health training. The medical, the training, the doctors and the nurses and the health professionals, they will have the health training, but they fail to transmit their messages. They don't have the political language. Actually, they find it is absurd to do consultation to discuss whether we need to reduce the price of medication or what. We should do it more. Why not? It's the way to go. They forget that by doing that, you need to lose other parts. The people with lived experience, obviously, they are the ones that are always left aside. They don't have sometimes a voice in the whole game, and they don't have a contribution to make. Meanwhile, they might not be academically trained, they might not be having the political leverage, but they are the one recipients of the intervention. They have a voice that should count. So when you realize that for the most part in Africa, we've approached the health with having those groups not talking to each other, you realize that is as you talk about the legitimacy. When you can look back at COVID, when the decision to make a vaccine came out, to vaccinate came out, we saw strongly how communities were rejecting it because they were not part of that decision process of whether we should vaccinate or not. So therefore, obviously, there were a big trust issues there, legitimacy issues there. What we need to move towards, again, by building an African health system for Africa, we know we have that tree in some of our countries in Africa, a baobab. I think is the same word in the same word in English. The baobab in African literature is a place of gathering.
Correct.
In the village, people will just gather around the baobab. Whether you are an elder, whether you are a youngster, whether you are a woman, whether you are a man, whether you are the farmer, whether you are the hunter, no distinction of anything. The chief is sitting there, everybody comes, we discuss the problem of the village together, everybody gives input. We need to reappropriate those ancestral knowledge and attitude to even health. Let's put the table, let's invite everybody. Communities around the table. Policymakers are there. Academics are there. Everybody bring his skills, bring an angle, and together we find a solution that is legitimate, embraced, and eventually can lead to obviously positive outcome. So it's sometimes having moved away from the way we've done things in the past have brought some challenges. We can reinvent, as they say in the process of decolonizing, they adopt some of those principles that our people, our forefathers were using to come back and apply it. And obviously that will be for the good for the health of the population.
For most of our discussion, what I draw from it is that when we look at 2045, when we look at the youngest population in the world, when we look at preserving the continent for our great-great-great-grand and future generations, it means that the continent needs some kind of a continental national health conference, starting from each country, starting from each region, holding a national conference for health. Because without a healthy population, we will not be here. They will not have the continent to live, to bequeath to future generations.
No, I like the idea. And my approach, because obviously that will be a strong endeavor to be able to realize something like that. So it should be part of it. There are some platforms, for example, the Conference of Public Health in Africa, I think is trying to do something like that, but not exactly the way you are describing it. The initiative, and I'm gonna talk about it here in exclusivity because I haven't gone public about it yet. We talk about Operation 2045, how we should start today, put together actions that we need to prevent NCDs in the future for the health of the continent. What I'm working on, and that I've started already consulting with some leaders in the continent and experts, is a think tank. You know, we are accustomed to think tanks in various spheres. There are think tanks that where people are coming together to talk about various things. There is no think tank on the continent focusing on NCDs and mental health.
Oh.
Therefore, that conversation that we are having, you and I, those ideas that we are bouncing up each other, there's no other places where such is happening, where you need to have an approach of foresight. We established that already now, epidemiological transition is happening, NCDs are surpassing communicable disease. We established that we have a young population, therefore, the burden, if nothing is done, will be terrible, will be great in the future. The think tank is therefore a group of people that I'm putting together, whether it's health, urbanism, architect, social, political, whatever fields that has a connection with prevention of NCDs. We come together and we imagine that Africa of tomorrow that prevents NCDs. What does it mean? It means maybe we talk about it in our education curriculum. It means we have cities where people can move easily. It means we reappropriate our food system. As you can see, I talk a lot about colonization and those things. Our food system have been completely distorted, whereby we are, most countries, what are our staple? Rice and pasta. These are not traditional African food. Where are our African food? Where is yam? Where is our potatoes? You realize that even in that field, food systems, there are efforts to be made. Transport. Some of us have moved away from our countries. But now it becomes so difficult to find the food that you were eating home, for example, here in South Africa. If there were trains getting up and down, somebody can collect a plantain in Cameroon yesterday. You have it here in South Africa in the morning because the train is going up and down, bringing merchandises and everything. So all those sectors, I'm putting together a group of people who will be then visualizing and having that foresight, that way of looking at the science today and projecting ourselves so that we can have an alternative to propose to our leader. It's something to say that our leaders have failed because they didn't know or because they were influenced by the external forces or the colonial powers and whatever. We need to propose an alternative. Therefore, the foresight, that coming together is important, but also the advocacy part of it. Because once we show, for example, that, hold on, this is the direction that we should go, we need to then engage with those leaders so that they can buy in. Because at the end of the day, they are the one who signed. They are the one who have the pen to sign. We're going to do this or we're going to do that. But ours, as professionals, as leaders, we are thinking that Africa of tomorrow, and we are proposing to them something with a horizon of 20, 40 years compared to those 5-year strategies that you can see.
That are around election cycles.
Yes, or the continental strategy that you will see either coming from WHO Afro or coming from Africa CDC. You see they're always like 5-year time. We need to have long-term
50-year spans.
You see, and start today, put together those steps, small, so that tomorrow we build that Africa that is what I call NCD resilient. So this is something that I've started. I've started consulting with a few people. I will start communicating on my LinkedIn page next month in February, and then continuing the build up and identifying. It's not I see it not as a platform that is open for all. No.
Yes.
We need to be selective because this is about strategy.
Yes.
This is about future thinking. So you need to be even selective in the people that you bring on board.
Yes.
And some will be permanent actors. Others will be because maybe he has an expertise in something that we need. We bring them on board. They help us. We need economists. We need all those various
systems thinking think tank.
Exactly. That's what I'm working with. And that's really what I see as my legacy for the continent. I want to start step by step. and maybe growing, when it starts growing, maybe I'll focus myself on it. So you realize that, as I said, there's a big vacuum, there's a looming threat. It's important that as the sons and daughters of Africa, we come together and we become shield for our fellow African brothers and sisters from all over the continent.
I see you've almost dealt with one, but last question, the one that talks about what would it mean to plan Africa's NCD response with a 20-year time horizon rather than short political or funding cycles, which is what you've already sort of talked about. And again, because of course, from lived experience, most programs are only tied to election cycles. And there was another academic that was speaking to me who says, politicians or most leaders, when they're studying, when they get into office, they talk for 2 years, and the third year they start thinking about re-election, which means most of the thinking that needs to go beyond term of office is sidelined or kept aside. But I think with this NCD 20-year time horizon is what you're already talking about around the think tank.
Exactly. We cannot be bound by our own limitations. Either you're a politician, you are limited by your terms in office, or you are an academic. What you are focusing is when you're gonna get tenure, when you're gonna be full professor. We have to be that Africa that surpasses itself in the sense that we look beyond. We look beyond. Even we took a bit of example in our African culture ancestry with the baobab. I wasn't there back in the days, but I know in all villages there's always, in French we say guérisseur. Here in South Africa they say sangoma. It can be looked as pejorative, but what those people are, they are people who are like, their job is foresight.
Yes.
Even in our African culture, we know you cannot live today for today. You need to have a view of tomorrow. When is the best time to plant the crops? When is the best time to gather the crops? When is the best time to eat? And should I eat everything? Should I keep it? Because then the elder or the one will come and say, you know what? I was working in the field. I think there won't be rain this year. So you guys should start keeping the what we've collected and not eat. So there's always been that
foresight
in our societies and cultures back in the days. Obviously, the description of colonization and all that, even as academics, even as experts, we can take that power back by saying, let's project ourselves. Instead of being firefighters that we discussed earlier, let's be builders. Let's put in place those systems, those things that need to be put in place so that tomorrow we don't have to respond to crisis, that we don't have to be in the victim of a big explosion in terms of overweight and obesity and all those challenges that are that could be affecting our population. That's thinking start today. And we don't need, similar to in the village, where it wasn't the function of all the people in the village to have that role. It was only one person. We also don't need the whole of the 1.5 billion Africans to be thinking that. A few of us who have that, who have had the eyes open in that way, we come together and we do that work, because that's really what should happen. And when we then put in place something like that, you then engage with the leaders. We get the support from some champions in some countries, and it starts a snowball and it starts spreading. But I think it's a work that needs to be done, and it's a work that is worth that will be worth fighting for, I believe.
Indeed. Doc, as we start to wrap up our conversation, I want you to speak to students. They could be undergrad, they could be in high school. Also, you can expand that comment to other researchers in other disciplines or in your specific discipline. Speak to students that are in high school, undergrad, or just starting postgrad about your specific discipline in terms of how you've combined you also transition a little bit, and now you're into public health system. Perhaps you want to just inspire the next generation of public health professionals.
Thank you. That's really something I like to do when I meet youngsters. I think looking at my own experience, some of it happened organically.
Yes.
Some of it happened just because of me being available and curious.
Yes.
Why am I saying that? I explained how I found myself in public health, and then I completed a master and I started working. I used to work in the HIV space. And then things happened. I found myself without a job, and an opportunity to come back to university to do a PhD opened, and it was a PhD related to diabetes. So as I was then doing the PhD and getting into the clinics, getting into communities, I started having my eyes and my ears open to identify what is actually that our people are suffering from, what is actually the challenges. Oh, there's no diabetes education. Oh, the drugs that we are using are outdated, this and this and that. And then I met a lady, her name is Bridget. She's living with type 1. She had started the Diabetes Alliance. She tells me about it. I said, why not? I would like to join. I have nothing to lose. I understand there's a problem. And if you tell me that this can bring a solution, then why not? So making myself then available, starting to be involved. I never knew what advocacy was. Then joining that fight. Now I'm leading the alliance myself after she nominated me to do so. And all these things has been open to me. So whereby it's not just being an academic and focusing on in whatever your goals are, maybe to publish 5 papers or to do this and that. What we all looking for or looking after is to effect change.
Yes.
We all hope that our motivation is to effect change. So if you're a student, yes, it's well and good to have good marks, but there's a difference between somebody who is studying for a degree and somebody who is studying because they are preparing themselves for a career. If you are preparing yourself for a career, degrees are not enough. You and I know that the difference on the job market is not just about having a qualification, it's the other things. So if you can volunteer in a community somewhere, good. If you are passionate about something, why not start your own thing? Even if it's a focus group, even if it's a whatever initiative, it should go beyond just looking for the degree, looking for the marks. You need to be able to open our eyes to what our people are suffering from. What are the burdens that our people are dealing with, so that we can help and alleviate a little bit. That applies for academics, apply even for people who are professionals. You can be a good accountant, but maybe you should realize that around you, people have poor financial literacy. So yes, it's good to make a lot of money being an accountant, but maybe you put 2 hours or 1 hour on the side to help people who have poor financial literacy. It's by giving ourselves that as Africans, we will be able to make a difference, rather than to sit and being, as society has wanted us to be, very selfish, very self-centered. I grow my own family, have my own career, have my money. If we open our mind and going back to those values that were ours or those of our ancestors, to give ourselves, that's how you find your purpose in society. That's how you become, beyond being just a medical doctor, you actually become a medical doctor who make a big change and change lives of people because you give of yourself. Whatever field really that one is. So really that's what my advice would be, is to be curious, is to not put money first. Because at the end of the day, if you put money first, your decision will be influenced by that. Sometimes, if the good of society is what motivates you, then just go for it. Sometimes you might not get financial reward out of it, but there are what I call intangibles. That are those things that are not cannot be are not financial, but that are really great and that actually bring a lot of joy in one heart when you lead your life like that. So that will really be my advice for the student and whoever is out there. Let's learn to give of ourselves in whatever we do, in our whatever form it is, and we can see them an impact in the future.
Doc, thank you. Is there anything that we left out? You and I have had a chat, and the reason for the podcast is that when an academic, a researcher, a researcher practitioner like yourself, I want them to take all the time that they need, because we are not a normal media where we are always they are constrained by time. For us, wanting to speak and explain and tell stories and inspire people that watch and listen. Anything that we left out in our conversation?
If it was to something that I would like to part in closing, one of the benefits, you mentioned the Kofi Annan Global Health Leadership that I benefited from last year. One of the things that we, not only it was a crop of 25 people selected out of like 6,000 candidates and from various nationalities. And one of the things that the Kofi Annan achieves is that we have residential where you visit in around countries. So we have the benefit of going to various African countries and engaging with the people there in the public state. That has really ignited in me a sense of Pan-Africanism.
Wow.
And I'm sure if you've listened to me, you kind of see
it. Yes, it's there. It's there.
My call will be for all of us as Africans, whether you are from Cameroon, from Togo, from Ghana, from Nigeria, from South Africa, let's cultivate a Pan-African spirit in everything we do. Let's not constrain ourselves to the borders of our country. Let's have a Pan-African view. Everything you're trying to solve, don't just solve it for South Africa or just for Benin or just for Morocco. Solve it for the continent, because we are all within. Those borders, we inherited them. We didn't decide to sit together and to put them there. Therefore, as you can call me a global health leader or academic or advocate, or everything that I do tends to now be infused by that Pan-African spirit.
Wonderful.
It's not just a political thing. It applies to health. It applies to really everything we do. And when we have that way of approaching things, we realize that, yes, as a continent, we have constraints, but there's also a lot of promises in this continent. And I think that's the beauty that my eyes were open to going through the Kofi Annan Fellowship. And I really hope that we are more taken by this fire, really, that to realize that we are all one. Let's think like that and make decisions in that way. I wish our president will have that approach. I wish our leaders, I wish all of us will have that Pan-African view to say, I'm a solution to a continent. I'm not a solution just to my country. And once you are a solution to a continent, obviously being the oldest continent in the world, being the cradle of humankind, you become the solution for humankind.
Dr. Patrick Ngassa Piotie, thank you so much.